So I got this question a lot in regards to my last post. And so if your child is struggling with anything that's listed on that video and that post with um, moving around a lot in bed, grinding their teeth, waking up a lot, hot and sweaty, wetting the bed, all of those things, your best bet is to find a myofunctional therapist or a therapist if they're under the age of, say, 3. It just depends on how well that they follow directions. The reason why I'm saying that is we can do a ton with the muscles that help support breathing, sleeping, and growing our faces to get enough room to help us respirate properly, to help us grow our face so we have enough room so it's not going to turn into a structural problem. So find a therapist that has training in myofunctional therapy, airway, sleep, tethered oral tissue, and breathing reeducation. And that's what we have at our practice. We have different levels of intervention. We have different therapists for different age groups. We have different types of therapy. We have body work. So it's unfortunately not a one size fits all answer, but definitely skip. I hate to say this, but skip the ENT, don't go there first. Find a therapist because we will have resources. We will connect you with the right people. We will kind of be the quarterback for what's the next move, because I know as a parent just trying to navigate when something's wrong with your child and calling the right people, that is a job in itself. So find a therapist that's close to you. We start working on getting the tongue moving, getting the tongue strong enough to seal in the palate, getting the jaws, getting the face muscles working like they should, getting the lips really strong so they can keep the mouth closed. If they keep the mouth closed during the day and the tongue sealed in the palate during the day, then that's going to happen at night and you're not going to get that collapsibility into that airway tissue. That's where it collapses and then they start moving around because their body has to wake up all night due to the disruption in oxygen delivery to the brain. And so once again, find a therapist that is trained and specializes in all of these things: airway, myofunctional therapy. It could look like oral motor reeducation or oral motor integration. It could look like we're doing some feeding therapy, but I also have training in airway and myofunctional therapy, so I'm going to deliver this a little differently, knowing what your child's symptoms are specifically in sleep. A lot of the times too with adenoidectomy and tonsillectomy, it's like 20 to 80% chance in a range. Maybe things will get better. I know from personal experience, I had my tonsils and adenoids out and my sleep continuously got worse over the years until I was 37 and stumbled into this specialty, and it changed my life. And that's why I do what I do, and that's why I'm here, and that's why I live, eat, breathe, and sleep this, because I know how monumental it can be to change a young child's life. It can change the trajectory of their quality of life. So once again, find a therapist and start there. We do virtual, we do telehealth. We see people globally and in person locally here in Phoenix, Central Phoenix and Mesa. So I hope this helps. I hope this reaches the right audience. And if you look for consults, go to My Myo, My Health. Definitely, it's worth consulting. We'll go over your health history. We'll go over your concerns. We'll go over what the plan should look like. Therapy is great. It just takes a while and you have to implement it. And there needs to be some carryover at home as well. There needs to be great modeling from the parents. So it shouldn't be looked at as a quick fix. You're having to rewire your body system completely to do what it should be doing that it missed out on early on. Okay, sorry this was long, but I have to say it.